Madelynn here, and I'm going to talk about eHealth, which is Chapter 19. First off, we should answer the question of what eHealth is. eHealth uses electronic processes and the internet in the healthcare practice. The number of hospitals and office-based physicians who have adopted eHealth records has nearly tripled since 2010. eHealth is a more convenient way for patients to access health records instead of visiting a medical office physically or maintain good health through apps. Most people have visited a doctor in their lifetime. When you go to a doctor, they keep medical documents on the visit that may include important information about your insurance, diagnosis, and medications they may prescribe to you. When children go to school, the school typically requests medical records. If you have moved out of state, you had previous medical records in, then you must go to the medical center and pick them up, which can be very inconvenient and out of the way. This is one reason why using eHealth is vital in our technologically evolving society. Between 70 and 70% of U.S. adults look online for health information. This could include searching on Google for information about what medicines or prescriptions do what and what side effects may occur. This could also be bad for some who are misguided by sources that aren't credible and may provide incorrect information. Background. The first evidence of healthcare was cave drawings, which suggested that early civilizations used plants as medicine. As society evolved, we found more ineffective ways to use technology in a medical environment. Since the early 70s, computers have been used to store patient information and practitioner records. In 1999, eHealth was introduced to the health industry. Early concerns were of privacy. This led to the creation of HIPAA, which allowed patients to have more control of their medical records. HIPAA, which stands for the Health Insurance Portability and Accountability Act, was enacted on April 14, 2003. HIPAA gives national standards to ensure people's medicinal records and other individual health data are protected. It creates suitable safeguards that health insurance providers, doctors, and others must accomplish to ensure the protection of health data. Recent eHealth developments. mHealth, which stands for Mobile Health, is a recent development of eHealth. Some apps I found while looking at the Samsung App Store include Intermountain Connect Care, which connects patients to Intermountain healthcare records. WebMD is also another popular app with over 5 million downloads. This app allows those with internet access to check what their symptoms might be and identify what pills are. It also allows people to set medication reminders and find medical services near them if in need. 52% of smartphone users have looked up health or medical information as of 2012. 97,000 mHealth applications have been created on app stores as of 2013. Electrocardiograms. Which are mobile phone based, can measure your heart rate from any location and send it into a doctor. This device could help patients with a history of heart disease or someone who is testing for heart disease. It could also help patients with diabetes, high cholesterol, or inflammatory disease to monitor their health at home without having to travel to go to the doctor. Another development in eHealth industry is e-gaming. E-games provide children in school an interactive and healthy way to learn. Wii Fit is another e-game system that has become very popular in the past years. Wii Fit can now connect to the Wii U, which shows how the devices have evolved to fit more popular demands in modern society. The Wii Fit devices can also help with physical therapy. Another eHealth device is a smart shirt. The smart shirt with enhanced microsensors that monitor temperature, heart rate, physical activity, and GPS for runners. My only question is it safe against sweat? A popular eHealth device right now is wristbands. One popular wristband is Fitbit, which allows users to track their exercise and encourages people to be more active throughout the day. Some people have their watch programmed to tell them when they've been sitting too long. The watch also allows the user to set goals for the day, such as steps. Once a user reaches a certain amount of steps, the watch may buzz and display fireworks. Apple Watch has similar features as well. One feature can detect a fall and contact emergency response. This may be important for elderly people who live alone and have an emergency. eHealth also provides security with telemedicine, which offers electronic clinical services to help people in rural areas. This is important for people living in rural areas because oftentimes the people have no access to a doctor when they need them. Also, in order to get out of bad living situations, it is important to have good health. The current status of eHealth. Patient Protection and Affordable Care Act was established on March 23, 2010. The Health and Educational Reconciliation Act amended the law on March 30, 2010. The name Affordable Care Act is typically used to name the last amended variant of the law. It's occasionally known as PACA or ACA or Obamacare. The PPACA has 3 essential objectives: extend access to medical coverage, ensure patients against discriminatory activities by insurance agencies, and lower costs. The U.S. spends significantly more on medicinal services than other industrialized countries, and the nature of health insurance is regularly much more awful. One inhibitor of adoption of eHealth is security. People are scared that their information could be stolen because the technology is new and more vulnerable. 7,095,145 patient records were impacted by security breaches in just 2013. Factors to watch in eHealth. Some predictions made in the book are listed below. Johns predicts that mHealth will reach 3.4 billion smartphone or tablet users in 2017. Wearables will hit 170 million units sold by 2017, and eHealth tech revenue will hit 26 billion by 2018. Some statistics of today include the United States has the highest percentage of users at 11.7% of the population using wearable eHealth devices, which is around 38 million people. That's just in the US alone. You could imagine how many more people use these devices around the world. $10.351 billion US were accumulated from China, the US, India, UK, and Germany in eHealth devices. In conclusion, eHealth has and will continue to reach mobile devices of people all over the world. eHealth also impacts people's lifestyle through daily use of wearable devices, which can help people maintain their health. Low-income countries that use mHealth and telemedicine has potential to help patients who don't live near medical centers, also those living in rural areas with no access to doctors. Using eHealth, people are able to access information about health questions they may have. The main concerns about eHealth is security, but as technology progresses, the security will become better. Quiz questions. mHealth has the potential to help people living in rural areas with no doctor. True or false? True. One of the first concerns of eHealth was and is A. Misinformation from non-credible sources, B. Security of medical information, C. Patients without internet, or D. People misusing the technology. The answer is B. Thank you for watching this video.